Hello everyone, welcome to my channel. In this video, we'll learn about electrocardiogram, ECG, right? If you want to understand or learn any concept in Hindi, you can visit my main channel, which is Physiology Hacks, and you can learn there all the practical videos as well. So in this video, we'll be talking about some basic concept of ECG, what is ECG wave and how it's being generated, right? Or if, for example, you get some question on ECG, so how you have to perform that, okay? So this will be a brief description about ECG. Okay, so what is ECG first of all? We get confused always between electrocardiogram, graph or graphy. These are three things, okay? So we should be knowing what is ECG here. So ECG is basically electrocardiogram, okay, which is electrical activity of heart from recorded by electrodes placed on surface of skin. But there is electrocardiograph and electrocardiography. Electrocardiograph is the machine used, not graph paper used, but machine used, right? And graphy is the procedure of recording of ECG. Okay, so we'll be talking about ECG. First of all, we should have a clear idea that what we are recording from surface actually. Whenever we apply electrode on surface, what are we actually recording that? Okay, is it action potential from one cell of heart or is it action potential of all the cell of heart? Are we recording it directly from heart? No, it's indirect recording. So what is this basically? For example, if we have a pacemaker in subcutaneous tissue, are we going to record that as well? Okay, so this concept you should have in mind about clarity of basically what is being recorded here, right? So this same concept is also applied for EMG and EEG. What is this concept? This concept is called as volume conduction. Volume conduction, where our subcutaneous or extracellular fluid outside our organs, it acts as volume conductor of various electrolyte exchanged around the organ. For example, if we talk about heart, okay, at various cells there are depolarization going on. So there is positivity inside some cells, and because of that positive charge increase inside, there is always negative charge increased outside, right? So whatever potential change, whatever electrolyte change occur inside, the opposite is also occurring outside. So which is ultimately going to influence the electronegativity or positivity of extracellular fluid. So wherever we apply two electrodes, we are going to measure the difference between two, the potential difference between the two. Okay. So because of those action potential, the change in ECF is being recorded, which we call as summated potentials. Okay, so this is just volume conduction. So what we are recording here, because the body fluids are good conductor, the fluctuations in potential in extracellular fluid representing algebraic sum of the action potential of myocardial fibers. So these are kind of summated action potential recorded indirectly via applying surface electrodes. To have a better understanding, we should also know about these two terms, bipolar and unipolar. Since we are applying two electrode on surface, we should be knowing that what is which type of recording it is, bipolar or unipolar. So bipolar is if ECG is recorded by use of two active electrodes, then the potential difference between these two electrodes is monitored, which is called bipolar recording, right? And in unipolar, where we have only one active electrode, which is basically connected to some indifferent or reference electrode at zero potential. Fine. So it is not considered as positive or negative, but we are just recording the potential change from this active electrode to some reference point, which is reference electrode. So potential change between reference and active electrode gives the unipolar recording. Okay, like this. So there is one electrode, two electrode, both are active electrode. So when we measure the potential change between two, one taken as positive and one negative, is bipolar recording. But for example, we apply two electrode 1 and 2, both are active electrode, and what we call, instruct the machine that this is a reference point. So with the reference to this point, we have to monitor the electrode. So this is separate recording, this is separate recording, and we call it as two unipolar recordings, right? So this is unipolar recording when one potential change is basically measured between one active and one reference electrode. Okay, so this is unipolar recording. We also have in our ECG various bipolar leads and unipolar leads. So both the methods we have used. But before going in detail about this concept, we should know what is Anthon triangle. So what is Anthon triangle basically? In volume conductor, sum of the potential at point of equilateral triangle with current source at center is 0 all the time. So what that means, what Anthon said is, if we place electrode on both the shoulders and some area around left thigh, so this assume this is equilateral triangle and taking the heart at center. So what he said is, assume this is equilateral triangle, the sum of all the potential change is 0. Okay. Using this Anthon triangle, bipolar recording of or ECG has been measured. He also gave Anthon law. He states that if ECG is recorded simultaneously with 3 bipolar leads, what are those 3 bipolar leads? Taking the Anthon triangle all sides. Okay, so lead 1, 2 and 3. We'll come to it later. But what he said is ECG is recorded simultaneously with these 3 bipolar leads. Sum of the potential recorded in lead 1 and 3 will be equal to potential in lead 2. Okay, so any lead 1, potential change is any lead 1 is equal to sum of other 2. So that was Anthon law. Okay, now let's see what is ECG. Fine. So we always call ECG as 12 lead ECG. What that means? Do we apply 12 electrodes? No. We apply only 10 electrodes. So what is lead here? Lead is nothing but combination of 2 electrodes. Okay. So lead is not a wire. It is combination of 2 electrodes. So we apply 10 electrodes on surface of various points and 6 chest electrode we apply, 3 limb electrodes we apply and 1 ground electrode we apply. So that's how we apply only 10 electrodes and we derive from those 10 electrodes 12 leads. Okay. Now let us see what are those 12 leads. 12 leads consist of bipolar leads and unipolar leads. Bipolar lead is using Anthon triangle, lead 1, lead 2 and lead 3. Okay. These leads are derived using Anthon triangle. Okay. And unipolar leads, if we see, there are 3 limb leads and 6 chest leads. So if you roughly see, there are 3 limb leads and 3 limb leads which are bipolar leads. So 3 unipolar, 3 bipolar and 6 chest leads. So these are 6 and 6. 6 limb leads and 6 chest leads. Okay. When we talk about unipolar recording, these all are basically, since we are talking about some reference point, so from one reference point toward the active electrode, it has some direction of flow. That's why it is denoted using V vector. So augmented leads are also shown as V, but augmented, that's why A before V, and these V chest leads V1 to V6. Fine. So one by one we'll try to understand what are these leads and how they are derived. Okay, first of all, see lead 1, 2 and 3. So if right shoulder is taken as negative and left arm is taken as positive, then from right arm to left arm, this lead is called lead 1. Okay. If right arm is taken as negative and left foot is taken as left lower limb or foot is taken as positive, then this right arm to left foot, this lead is called lead 2. Okay. From left arm taken as negative and left foot taken as positive, this direction of flow is called lead 3. And since all are active electrodes, that's why these leads are bipolar leads. Okay. So lead 1, lead 2 and lead 3. These are bipolar limb leads. Fine. So this is direction of flow. If you have confusion in remembering these positive and negative, just assume that right shoulder is negative totally and left foot is positive totally and arrange accordingly the direction of flow. Okay. So this is about limb lead. Let's see now unipolar. Okay, now talking about augmented lead first. Okay, these are AVR, AVL, AVF, right? So we have to see how these are derived. So in this type of E, two of limbs are connected through electrical resistance to negative terminal, and third lead is taken as positive, which is the active electrodes, right? So what happens basically? For example, we are talking about right side, right shoulder. So that right shoulder is basically considered positive as active electrode. Rest two are basically connected with some resistance and taken as negative. Now this negative to positive vector is our AVR. AVR, augmented vector of right side, right? So this is augmented with AVR. Same applies for AVL and AVF. Fine. So AVL is basically left side taken as positive and rest two are connected through resistance. So this will be, this will be your AVL. Okay. And what is AVF then? Obviously foot will be taken as positive and rest two are basically connected with resistance taken as negative. So this is your AVF, right? So AVL, this is AVL like this, taken as negative. So are you getting me? Now the same direction. This is AVL and this is your AVF. These three are augmented leads. So this is AVR, this is AVL and this is AVF. Talking about chest leads now. So what happens basically in a two-dimensional plane? If you talk about heart at center, if you assume this is heart, right? So what you have done? You have measured in this plane as lead 1, right? You have measured in this plane as lead 2. You have measured in this plane as lead 3. So cavity is missing here. So you have measured in this plane as AVR. You have measured in this plane as AVL. You have measured in this plane AVF. Okay, so approx two-dimensional plane of heart activity we have captured. But assume this is heart, right? For example, this is heart. So this and lateral activity is not captured, right? Two-dimensional we have done. But what if there is some issue or MI in anterior, posterior, diameter or lateral side? So if this is heart, which is a 3D activity, we have to measure the anterior, posterior and lateral planes as our chest leads. Okay, that's why we need 6 precordial leads. Fine. 3 bipolar, 3 augmented leads records the current flow in 2D plane covering all the direction, but anterior posterior plane is left. So to rule out any current flow problem in 3D plane, the chest leads are used. Okay, using one electrode over anterior surface directly over heart connected to positive terminal. Here also we have indifferent electrodes, so these are unipolar recording, right? Okay. These are V1 to V6. V1, so you don't have to mug up these things. This is very easy actually. V1 and V2 are fourth intercostal space. One toward right side of sternum, one toward left side of sternum. V4, V5, V6 are at fifth intercostal space. The difference is mid-clavicular line, anterior axillary line and mid-axillary line. And V3 is between V2 and V4 exactly. So this is V1, fourth intercostal space. These are ribs. This is fourth rib and this is fourth intercostal space. So on right side V1, on left side V2, right? And V4 mid axillary line. So mid clavicular line. This is clavicle and mid of the clavicle. So at fourth intercostal space at mid clavicular line. If you see axilla, the starting anterior axillary line if we draw, this is your at V4, V5. So fourth intercostal space, anterior axillary line V5 and mid axillary line V6. So V4, V5, V6, right? And V3 is basically between V2 and V4 exactly. Let us now see what is ECG. So if we talk about ECG, the wave came out is this wave, which is one P wave, then straight line, then QRS complex and T wave. Okay, so there are various segments, various interval. The flat portion, which is the isoelectric portion between these waves, is always a segment, right? Interval is when with these segments, when we calculate some waves also, Those are called intervals. So basically, whenever this question is being asked that explain ECG, we have to draw this and explain one by one all the wave segment and intervals and their duration. Right? So ECG wave consists of P wave, QRS complex and T wave. P wave is of 0.08 to 1 second duration, 0.1, and QRS complex is 0.08 second. T wave is 0.27 second. Okay, there are segments which are the flat portions, PR segment for example. So from here, end of the P wave and till here, PR segment. This it's before Q in fact, before starting of the QRS complex. Segment is always starting from the isoelectric flat line till the isoelectric flat line only. No waves are included segments, right? So this is PR segment and ST segment and TP segment. ST segment is from end of this QRS complex till the starting of T wave. This is ST segment and this is TP segment. So all the flat portion, you don't have to worry about what we are saying. For example, PR. It's not from P to R, obviously. It's before Q wave in fact. So PR is ending on starting of the QRS complex. So this you have to remember just. Intervals are basically including those waves. For example, PR interval. So P wave will be included plus PR segment is PR interval. Then is your QT interval. QT interval is including this QRS complex plus your ST segment. This is your QT interval. ST interval is basically ST segment plus T wave. Okay. So you can also see here this is your QT interval in which QRS complex, then ST segment and then T wave is included. ST interval, ST segment plus T wave. Okay, this is your PR segment and this is your PR interval. Okay. So if you get this question in exam, that's how you have to explain. So segments are the isoelectric line with zero potential change. PR segment, interval from end of P wave till starting of QRS complex, normal duration you have to measure. PR segment. Okay. Then ST segment. ST segment is from end of QRS complex to start of T wave. This is ST segment. Okay. Interval, PR interval, which is very important to rule out heart block. P wave plus PR segment. Okay. The duration is basically 0.16 till 0.2. More than 0.2 is taken as heart block. Then is QT interval. QT interval. So you have to include the QRS, start of QRS complex to end of T wave. So 2 wave plus 1 segment you have to include here. Okay. J point is basically the point between S wave and ST segment. So this deflection is basically J point, is point of no electrical activity. U wave is slow depolarization of capillary muscle, 0.08 second. Normally it is not apparent. Okay, then whenever ECG is being asked, you will be 100% asked about ionic basis of ECG. That is, what is ionic basis of P wave, QRS and T wave. P wave is basically because of atrial depolarization. Mind it, most of the students write atrial systole here. Systole is a mechanical activity. This is depolarization. QRS wave is because of ventricle depolarization, not systole. Ventricular depolarization. And T wave is when ventricles are repolarizing. So ventricular repolarization phase. Now let's see brief description of why there is some positive deflection, then we have straight line, why there is negative deflection, why there is positive again, then negative, then straight line and then one more positive deflection. So basically this is very important why we are having this type of waveform as ECG. So assume this is heart, okay. At one time the common vector, the common direction of potential change in heart is this one. This is the main vector. Okay, so whenever the action potential or depolarization wave is going in the same direction of this vector, the positive wave will arise. Okay, whenever there is no any direction of potential change with respect to this vector, it will be straight line. And whenever the direction of potential change is opposite to this vector, there is negative deflection. Okay, so let's just see briefly that how PQRS complex and T wave arise. So starting from the P wave is showing atrial depolarization. So from SA node, the action potential is now transmitting toward the AV node. Okay, and since this direction of current is same as this vector, so it came out to be positive wave. Then coming about this PR segment, here again assume this is heart, and at AV node there is no transmission of further impulse because of AV nodal delay, and that's why it is straight line, isoelectric line. Okay, then what happens basically from AV node, now the impulse is transmitting, the wave of depolarization is transmitting in septum. Okay, because of this, the current, because of the arrangement of septum, the current flow, the depolarization wave is flowing opposite to the vector, and that's why we have negative deflection. Then ventricles are depolarizing, and since it is in same direction, so because of ventricle depolarization, R wave came out to be positive. Then you have the basal part of the ventricle which is to be depolarized, and since basal part, so the direction is opposite on both sides, and that's why S wave is negative. After that, once depolarization is complete, there is no depolarization which is moving in any direction, and repolarization has not yet started, and that's why again this is isoelectric line. Then afterward, repolarization wave moves on opposite direction, and since this is opposite direction but repolarization, that's why the movement of ion is same. It is positive, this was negative, this was positive. So depolarization wave was this side from negative to positive. Okay, and now this is opposite, which is repolarization, and that's why it is again a positive wave. So opposite direction but repolarization, and that's why this is positive wave, and that's how this is basis of ECG waves. Okay, so that's all about what is ECG, what are 12 lead ECG, what is this ECG wave, meaning of all the waves, segments and intervals and their duration, and this is basically origin of ECG wave, how these are originated. So that's all for today. I hope you understood ECG. If you have any query, you can comment below. In next video, we'll be talking about cardiac output. Thank you so much for watching. Keep learning. If you want Hindi video, you can visit my Physiology next channel. Thank you.